The Federal Capital Territory Primary Healthcare Board is the agency in charge of the COVID-19 vaccine rollout in the nation's capital. So far, the nation's capital has over 19,000 confirmed cases of COVID-19. Over 2,000 patients are still on admission in the functioning isolation centers across the FCT, and over 17,000 persons have been discharged. 156 deaths have been recorded as of March the 30th, 2021. When it comes to vaccination, of the 3.94 million doses of the Oxford AstraZeneca vaccines Nigeria received in early March of 2021, the FCT got over 227,000 doses, and from its 65 vaccination centers has given the first jab of the vaccine to over 36,000 persons. Health workers like Madam Aisha Galadinchi pound the pavements of the nation's capital daily to increase these figures and ensure the FCT achieves herd immunity by vaccinating at least 70% of its population by the end of 2022.
On Friday, I vaccinated about 250 people, and nothing happened, and they are happy.
There are people that are complaining that the vaccine can have side effects. Do you see anything like that in the FCT?
Nobody. I didn't hear anything like that.
The vaccines are distributed and managed by the FCT Primary Healthcare Board, and its executive secretary says that rollout may be reduced amid fears that the second consignment of the vaccine might be later than the approved 12 weeks.
We are expecting that these people that have been vaccinated now should have their second dose, and a new supply is expected. But the signals the feelers that we are having from the national is like the supply may not be timely, that may not come at a time, because it should come around June, so that you can give these people their jobs. But it appears we may not have that supply by June, and we are being careful now not to use everything for the first dose. Probably if we use half of that, we do 50% of what we have, we use the other 50 and be the second dose in case the one we are expecting doesn't come. So when you are taking and you have been given the optimum time that you should take the second dose to enhance the effect of the first dose, and then you decide to delay, there will still be some effect, but not up to the optimum that we can say that we guarantee your immunity.
So would you have to probably take both doses again?
Sure, but you have to give yourself some time, probably 6 months. The demand from the citizens are even more. The demands from the citizens are more, and it is shocking. I can't explain that.
So we tested this theory on the streets of Garki, Area 10 in the nation's capital. Just how excited are residents of the nation's capital about this vaccine?
Why will I take vaccine? Am I a COVID-19 patient?
I need the one that is homemade. If that is homemade vaccine, fine. I'll vaccine myself 3 times or 5 times. But if it's outside Nigeria, I'm not interested.
Why I'm discouraged is I went to like 2 places. When I got there, I was on queue. Almost how many minutes? At the end of the day, they said that the vaccine has finished.
This issue of coronavirus, you will take a vaccine and you still be having a social distance with people. You will still be afraid to shake. You will still be afraid to leave your nose open. Then I'm doubting that, is it true a vaccine or is fake vaccine?
Why are you minding vaccine from China, vaccine from... Do you know the source of that vaccine?
Not so much. Although not everyone is buying the conspiracy theories. At the Garki Area 2 vaccination center, these respondents are excited about getting their vaccination.
I feel normal. I don't feel anything, no numbness, nothing. I was expecting it to be more like the injection, but it doesn't feel anything at all.
To me, if I want to be a conspiracy theorist, if you're trying to get all of us in trouble, world leaders wouldn't be taking the vaccines.
The vaccination process is simple. You register your details and the staff makes sure you're eligible to be vaccinated.
According to what they said, it's from 18 years and above. So if they are still breastfeeding their babies, I don't think the baby will be safe.
After you're captured, you make your way to the nurse who administers the painless jab. and your vaccination card is given to you as you wait for the second jab to be administered in 12 weeks. Kayla Megwa, Channels Television News.